Pneumothorax. Pneumothorax is air in the pleural space. As a result of the air in the pleural space, there is partial or complete collapse of the lungs. This condition should be suspected after any blunt trauma to the chest wall. Pneumothorax may be closed or open. Pneumothorax associated with the trauma may be accompanied by hemothorax, a condition called pneumothorax. Types of pneumothorax. Types are closed pneumothorax, open pneumothorax, tension pneumothorax, hemothorax, chylothorax. We will discuss types in detail. Closed pneumothorax. Closed pneumothorax has no associated external wound. The most common form is a spontaneous pneumothorax, which is accumulation of air in the pleural space without an apparent antecedent event. It is caused by rupture of small bulbs on the visceral pleural space. This cause of the bulbs is unknown. This condition occurs most commonly in underweight male cigarette smokers between 20 and 40 years of age. This is a tendency for this condition to recur. Other causes of closed pneumothorax include injury to the lungs from mechanical ventilation, injury to the lungs from insertion of a subclavian catheter, perforation of the esophagus, injury to the lungs from broken ribs, ruptured bulbs or bullae in the patients with COPD. COPD means chronic obstructive pulmonary disease. Next type is open pneumothorax. Open pneumothorax occurs when air entered the pleural space through an opening in the chest wall. Examples include stab or gunshot wounds and surgical thoracotomy. A penetrating chest wound is often referred to as a sucking chest wound. An open pneumothorax should be covered with a vented dressing. This allows air to escape from the vent and decrease the likelihood of tension pneumothorax developing. If the object that caused the open chest wound is still in place, it should not be removed until a physician is present. The impaled object should be stabilized with a bulky dressing. Hemothorax. Hemothorax is an accumulation of blood in the interpleural space. It is frequently found in associated with open pneumothorax and is then called as hemopneumothorax. Causes of hemothorax include chest trauma, lung malignancy, complication of anticoagulant therapy, pulmonary embolism, and tearing of pleural adhesions. Hemothorax, blood in pleural space, usually occur in conjunction with the pneumothorax. Clinical manifestation of hemothorax are dyspnea, diminution or absent breath sound, dull to percussion, shock. Emergency management of hemothorax is chest tube insertion with the chest drainage system. And also treatment of hypovolemia is necessary. Tension pneumothorax. Tension pneumothorax is a pneumothorax with rapid accumulation of air in the pleural space causing severely high intrapleural pressure with resultant tension on the heart and great vessels. It may result from either an open or closed pneumothorax. In an open chest wound, a flap may act as a non-way valve. Thus, Air can enter on inspiration but cannot escape. The intrathoracic pressure increases, the lung collapses, and the mediastinum shifts toward the unaffected side, which is subsequently compressed. As the pressure increases, cardiac output is altered because of decreased venous return and compression of the vena cava and aorta. Tension pneumothorax can occur with mechanical ventilation and resuscitative effort. It can also occur if chest tubes are clamped or become blocked in a patient with a pneumothorax. Unclamping the tube or relief of the obstruction will remedy this situation. Tension pneumothorax is a medical emergency with both the respiratory and circulatory systems affected. If the tension in the pleural space is not relieved, the patient is likely to die from inadequate cardiac output or severe hypoxemia. The emergency management is to insert a large bore needle into the chest wall to release the trapped air. Tension pneumothorax. Air in pleural space that does not escape continues to increase in the amount of air shift intrathoracic organs and increase intrathoracic pressure. The clinical manifestation of tension pneumothorax are cyanosis, air hunger, violent agitation, tracheal deviation away from the affected side, subcutaneous emphysema, neck vein distension, hyperresonance to percussion. Emergency medical management of tension pneumothorax is medical emergency, that is needle decompression followed by chest tube insertion with the chest drainage system. Chylothorax. Chylothorax is a lymphatic fluid in the pleural space due to a leak in thoracic duct. Causes include trauma, surgical procedures, and malignancy. The thoracic duct is disrupted and the chylous fluid, milky white and high lipid contents, fill the pleural space. Total lymphatic flow through the thoracic duct is 1500 to 2400 ml per day. 50% of cases will heal with the conservative treatment. Conservative treatments are chest drainage, bowel rest, and parenteral nutrition. Surgery and pleurodesis are options. If conservative therapy fails, pleurodesis is the artificial production of adhesion between the parietal and the visceral pleura, usually done with a chemical sclerotic agent. Clinical manifestations. If the pneumothorax is small, mild tachycardia and dyspnea may be the only manifestation. If the pneumothorax is large, respiratory distress may be present, including shallow rapid respiration, dyspnea, air hunger, and oxygen desaturation. Chest pain and a cough with or without hemoptysis may be present. On auscultation, there is no breath sounds over the affected area. A chest X-ray shows the presence of air or fluid in the pleural space. If a tension pneumothorax develops, severe respiratory distress, tachycardia, and hypotension occur. Mediastinal displacement can occur with a tracheal shift to the unaffected side. The patient is hemodynamically unstable in the medically emergency. In this medical emergency, collaborative care. Treatment depends on the severity of pneumothorax and the nature of the underlying disease. If the patient is stable and the amount of air and fluid accumulated in the intrapleural space is minimal, no treatment may be needed, as the pneumothorax will resolve spontaneously. If the amount of air or fluid is minimal, the pleural space also can be aspirated with a large bore needle. As a life-saving measure, needle venting of the pleural space may be used. A Heimlich valve may also be used to evacuate air from the pleural space. The Heimlich valve is a portable, lightweight, one-way flutter valve device similar to a water seal drain. The most definitive and common form of treatment of pneumothorax and hemothorax is to insert a chest tube and connect it to a water seal drainage. Repeated spontaneous pneumothorax may needed to be treated surgically by a partial pleurectomy, stapling or pleurodesis to promote adhesion of the pleurae to one another.